So it's a wonderful subject for deliberation today and discussions today, and it's about investments in the sector of fertility, expectations, challenges, and how to move forward. Now, from my own premise, the premise that I would want to start with is that investments are the fuel, are an essential ingredient if you want any field, any sector to flourish. That is the reason why countries have huge, substantial portions of their GDPs directed at investments in potential sectors, on R&D. So we do feel, we do agree that investments, for his opening remarks on the entire edifice. And
so I wear multiple hats. I've been an IVF specialist for nearly 35 years now. I'm also an active angel investor. And I completely agree with what you're saying, that without money, it's not possible to do any of these treatments. So I am a capitalist. There's no question about that. I think profits are good. I think we need money in order to make IVF available, accessible, affordable. And in order to do that, putting in money makes a world of a difference. The only question is that, is the money being put to use properly? And I think we need to remind ourselves that the only reason we're on this panel is for the sake of our patients. And we sometimes lose sight of that. I think the difference between perhaps a doctor who runs an IVF clinic and a chain of IVF clinics is the doctor puts his patients first and he earns profits based on the service which he provides to his patients. With VCs, it's slightly different. Capital is capital, it's agnostic. You know, you put up a factory, you put up a hospital, you put up this thing. At the end of the day, what you're looking for is an ROI or a return on investment, which means you put your profits first and then you decide what you can do from your patients in order to get the profit. And now I'm not saying that individual clinics are ethical, I'm not saying large clinics are unethical, please understand that. All I'm trying to say is that we need not to lose sight of the fact that patients come first. And there's actually a very simple solution, and I've been saying this now for nearly 25 years. And like someone said, there's no point in talking to good IVF doctors because they're good anyway. There's no point in talking to bad IVF doctors because they're never going to improve no matter what you do. So our focus has always been on patient education and information therapy, which applies whatever clinic you go to. And we say there's only one thing an IVF clinic can do, and that is make embryos. That's it. Once we make an embryo and put it back in the uterus, whether that embryo will implant is not something I can control. But if I give each patient a photograph of the embryo which I've created for that patient, that automatically solves a lot of problems. There's openness, there's transparency, the patient has confidence in the clinic, whether it's a clinic which is run by VCs, whether it's a clinic run by an individual doctor. And I think this is such a simple enabling step. Someone was saying, you know, we run all these IVF clinics, we do so many cycles, but Indian doctors are still not respected internationally because no one trusts our figures. People think we fudge them. But if you provided an embryo photo to each patient proactively and routinely, I think a lot of these problems would go away. So that's my only focus, is what do we do in order to keep patients first? I think everything else will follow automatically.
right. Excellent inputs. You know, Aniruddha, you have really opened up the house for a lot of deliberations, this way or that way. Coming to you, Kshitiz, you know, from the perspective of Indira IVF, so Aniruddha has already, you know, spoken and raised a number of issues, of which the first one which caught my attention was that, you know, such clinics or chains of clinics tend to be very ROI oriented, and patient care tends to take a back seat. Your views on that?
Thanks, first of all, for inviting me. I think it's going to be a firing session with the opening remarks.
Yes,
just,
yes.
Just to comment, I think what Dr. Malpani said between ethical and non-ethical, I would you know, maintain my maturity not to comment on any single clinic run by a doctor or a chain of clinics run by VCs or private equities or CEOs of the company and saying that they could be non-ethical, they could be placing profits before the patients. So, I mean, using this platform, I just want to clarify, and I think everybody would resonate with me that individually run clinics by single doctors are much more profitable in the country as of now, if you see the data, compared to all the clinic chains, if you compare the EBITDA levels or profitability. So I think that data is so strongly present in front of us that proves that whatever money is going inside improving the governance, improving the quality of treatment that we offer at a clinic chain could be far superior compared to a individual clinic or individual doctor. And I agree to the last panel discussions of ART bill, surrogacy bill. And I think because I can relate it to more because we had some discussions with private equity back in 2013, 2017. Finally, somebody invested in 2019 with us. And now also our investors would look for some sort of exits in the coming years. And the confidence of the private equity world or the VC world that I see now, today, after the ART bill, is 100 times more than what I saw back in 6 years back or 5 years back. Everybody would come and doubt us 6 years back. What is happening with the ART bill? What is there in the draft? How are you regulating yourself? How will you conduct these practices? What happens if tomorrow this act gets changed, this clause gets added? What will happen to the overall cycle, right? These were the questions that would come to you 6 years back. Now, the questions that come to us in the current time, and Vinesh would know because he's currently actively doing all those raisings and investments, is how every center, every clinic is conforming to the ART Act. Nitish said, Act is Act, everybody has to follow. Now the targeted questions are coming. This is the law. This is the point. How are you managing compliance in your clinic? And we are very nicely showing up as a clinic chain or an individual doctor, whosoever is sincere in their efforts of understanding the act, jotting down the points, creating all those performers, and make sure that you follow. And why make such a hue and cry? Why make such a big issue out of it? We've been all following the medical laws. We've been all following the PCPNDT Act. If there is some more act, it's okay. There are teething issues. There are some things which we all collectively need to represent and change, and that will change in the coming time. I think second point on ethics and chains versus individual clinic, I think what I have noticed in my personal experience is private equity money comes not only with a return on investment matrix that, okay, I need 15%, 20% return, place profits before the patients, earn me money and give me my money back. I think everybody who has taken private equity investments would strongly relate that ethics and earning the money the right way comes very much in the forefront when a private equity capital comes to you. So it is a very painful process to take money from a private equity, continue running your business the way you want, and expect to return back their money in the next 4 to 5 years, right? It's a difficult process, and I'm telling you because I've gone through that process in the last 4 or 5 years. It's not easy that money is lying on the table. You just go and collect money, put it in your pocket, and do all sorts of investments, and then, don't care about ethics. Private equity, they would eat your head every day, every night, and all these people are from Europe, US, or big countries, right? Big nations, and where ethics are given utmost importance. Earn money, nobody is stopping you to earn money, but earn money the right way, which is much more sustainable, which has a lot of governance in your whole structure, which is environment friendly, and obviously patient has to be patient friendly. You can't be just playing around with the patient and start earning. That's a very tunneled, short-sighted vision that anybody would have, that I just want to earn profits and not care about the patients. You will fall down in 6 months or 1 year. You can't sustain your life or open 100 centers or 200 clinics and keep continuing your work if you're placing profits every time before the patients. So I think that's just my initial thoughts on the subject, and happy to hear comments from other people.
Great. So Kshitiz, you have provided an alternative perspective to what Dr. Malpani said earlier. Now, coming from the point of view of the topic for today's discussion, do you see any major challenges, barriers to investments in this particular sector?
I think the biggest factor that would now help getting more money from private equity and VC, I think the biggest single factor is the ART bill. Everybody is having now super comfort on what is the law of the land. Is any clinic conforming to those standards? Yes, you can, you can attract private equity money and continue your expansion. And I think most of the people in the room would agree that IVF, all said and done, is good profits, right? It's not a very thin margin business that you're operating on. So I think the money that you would want probably is completely not to put up your setups. I want to put up 10 clinics or 50 clinics, I need X amount of money. If you're systematically working, probably you would get certain profits which would help you in expansion in a systematic way. Nobody's looking for money just to boom out in the market and expand to 100 clinics overnight. I think it's all ethical capital, I would put it in that way, that comes to you with a lot of ethics and burden on you to manage compliance, governance, everything in your company. And I think in a long run, it's very good because an entrepreneur versus an investor, you need to mature from an entrepreneur to an investor eventually in your business also. So you start looking at your business from that outside view and institute the required governance and structure in your company.
Of course, I mean, to put your money where your mouth is, that is what an investor is. Now, there is something which has been going on, deliberated upon since the last panel discussion, which was about the ART bill. My own thoughts on it would be, and since you also mentioned it, would be that laws are meant to make the lives of people easier. Because there have been all kinds of laws. If you look at the history of mankind, I mean, there was somebody called Simon also who enacted a law. So laws are not beyond scrutiny, is what I would feel. And at the end of the day, the success of a law depends on, according to me, would depend on the success of the people for whom it was meant, how profitable it was, how easy it was for them to comply, and that would eventually decide the outcome. Now, the past two views which have come from Kshitiz and also from Dr. Malpani have provided a very good segue to you, Vinesh. You saw both sides of the coin, where Aniruddha talked about a very ROI, kind of a mentality. Kshitiz said that, no, it's not true, the chains are not that profitable. What is your take on it, particularly keeping in view that you come from that equity management background? I mean, you would be the best person in the room to actually comment on something like this.
So, interesting day. Thank you very much, first, ET, to invite me. It's a very interesting deliberation since last 1.5 hours. I would will want to take a step back and see from the perspective of where we are sitting today in India. I think we all feel proud being in India in the current times where the whole world is talking about India being the growth engine for the world. I don't see there is anything different in the fertility industry also. Today, you take a step back and see our demography. We have the highest young population in the world. We have one of the highest urge of parenthood in the world. This also brings a demographic that we have because of changing lifestyle, late marriages, and more adopting to a lifestyle which is bringing more infertile patients to the country. And I think in your opening remark, you said this very interesting statement that we have more than 50 million couples who are suffering from infertility in India. And India, in next 2-3 years, everybody now agrees that it will become the fertility treatment capital of the world. With this kind of demographic in front of us, this kind of potential in front of us, we are still scratching surface. We are a very under-penetrated market. We are just taking off the industry. The cruising altitude maybe is a million cycle, as Dr. Nandita mentioned. We are 10, 15, 20 years away of the real potential of India. So I think law was something which was pending from last 10 years. I am listening this committee led by Dr. Kamini Rao, Dr. Banker, Pramod Bhargava from last 15 years. I believe out of all the discussion and hearing it has came at right time. It will help industry to take off. Yes, there are teething problems, but it was need of the hour. I think now at least we can say what is allowed, what is not allowed. My long-term positive view is that it will push industry in right direction of better governance, better quality, better ethical standards. I also agree 100% to Dr. Kshitiz's view. This has increased sentiments of investment, which is very, very critical to really explore the real potential of Indian fertility industry. We will get more investment, more organized investment because there is law. We will cross this learning curve of teething problem of understanding law. And I am sure there will be some change which will keep coming, which I think we have seen in last few months. So every law comes with teething issues, but it's in right time, it's in right place. I believe it's with right intention. And I mean, if you ask me, I have seen IVF practice being operation head, chief operating officer before the law, and now I am seeing after the law. I think we have quickly learned in few months how to understand the law, change our practice, adhere to the practice. From where I see, it is only improving governance. It's improving the quality management. And it is, at least there is some basic quality standards in place. So overall, I believe right thing to happen. And it will help us to attract better investment. And as Dr. Kshitiz said, I completely agree to the view that when there is a organized investment, it comes with lots of responsibility of governance, management, and quality. As a country today, we have 2,000 clinics doing 250,000 cycles. We are number 2, number 3 in the world. This will only push us towards becoming fertility treatment capital in next 2 to 3 years. I think we have a fantastic potential future ahead for fertility industry. Also from human side, helping millions of couples to do right treatment, achieve their dream of parenthood, make our country with more young population, better demand, and of course, more happy. Thank you.
Right. So, sticking on to you, Vinesh, so vis-a-vis investments, do you think that there is a favorable climate? Or if there is, what are the ways in which it can be improved?
So as I said, climate definitely is favorable because the demography dividend is on our side. And more with the law and more with professional investment coming in the industry and the quality standards of the country going up. I mean, if I witness from being one of the founding member of India's first private equity-backed IVF chain, I think from mid 30% clinical outcome, today we very confidently see mid 50, 60% clinical outcomes in India. So we have crossed a lot. Today, I don't think anywhere in the world in developed country can boast doing anything better than what we do. So as a country, we have very good clinical outcome, very good doctors, very good embryologists, good investment is coming. Our clinical outcomes are best compared to one of the best in the world. I think we are almost there. Also, I listen a lot of discussion about IVF being costly, but you see around us, IVF in Sri Lanka is costlier than India. IVF in Bangladesh is costlier than India. Forget about developed country like Europe where it is $10,000 and 10,000 euro. We do quality IVF, quality standard, better clinical outcomes in $2,000. I think it's very, very favorable condition. Very helpful is industry in India, especially Indian homegrown pharma companies like Bharat Serum, where we get hormones, good quality at economical rate. So I don't know. I see everything favorable in the direction of better days ahead. And it's a sunshine sector. And I think we are 10, 20 years away, cruising altitude or something where we can discuss about saturation, which most countries discuss today. So very, very exciting times ahead.
Wonderful. Dr. Malpani, would you like to add on to the progress that we have made in the deliberations?
So, I think I don't want to be adversarial here. Please understand, we're all here for the sake of our patients. But let's also be honest. I've sat in a boardroom and I've also sat in a consulting room. And the hats which you wear in a boardroom and the hats which you wear in a consulting room are completely different. Most people who sit in a boardroom have never seen a patient in their life and really couldn't care less about what happens to that patient. That patient becomes cycle number 1002 or 1003 or whatever else it is. So let's not pretend. Let's also accept the fact that as far as private equity is concerned, they are domain agnostic. If I get an ROI of an IVF clinic, which is a sunshine sector, which is going to be 15%, I'll put my money there. If tomorrow I don't think it's a sunshine sector and it's going somewhere else, I put my money somewhere else. As an IVF doctor, I can't switch off and say, hey, IVF is now a sunset sector and therefore I need to become a cardiac surgeon. So there is a lot more skin in the game as far as a clinician is concerned. Please let's lose sight of that. I think it's great that there is corporatization. But if anyone tells me that PE money comes with great governance, then obviously you've not read anything about Byju's at all. So, just because there are good clinicians doesn't mean there aren't bad clinicians. And just because there are bad VC and PE players doesn't mean that all of them are bad. All I'm trying to say is we need to be able to accept our shortcomings. And I've been practicing as a clinician before the law came and after the law came. And what is the difference? The only difference is now I have 10 other paper forms to fill up. Because I always used to do the same thing, which was the right thing for my patients before the law and after the law. Now, because I fill up that paperwork, I have to charge my patients a lot more money, which is actually not increasing their success rates. I think there are a lot of fly-by-night operators. I think having some of these safeguards and checks about. But if I were the minister, there were two things I would have done. I would have made insurance compulsory for IVF. Now, that's an enabling legislation. That's a supportive legislation which is going to increase the number of IVF cycles. Did anyone do that? No. All you've tried to do is punish doctors for not filling forms properly. That's not my idea of an enabling legislation. And I think, as I said again, the second thing is paperwork, checkbox. Our pregnancy rates are 50%, 55%. We compare with the rest of the world. You go to an international conference and people laugh when IVF clinics from India present their reports because all of us add a zero whenever we feel like, and there's really no quality control. This is not something which makes me proud. And that's what I was saying. If it were enabling, then it's possible to say, hey, this is what the SART has, this is what the HFE has. They've been regulating for many years. We could have adopted the good practices rather than just worry about, okay, we have all this paperwork and let's fill it up. Again, that's my point of view. I'm often not politically correct. I apologize about this, but I care. I've been a doctor for 35 years. That's one thing I think I know how to do well.
No, absolutely. We welcome your comments, Dr. Malpani, because I personally feel that a debate or a discussion without a diversity of views is actually non-productive. It doesn't serve any purpose.
He's still my friend, so I don't want him to not be my friend at the end.
Yes. We are all friends. So, sticking on to you, Dr. Malpani, we have been talking about the law a lot, and so that has also eaten into our discussion. Do you think there would be any bearing with the coming of this law on the investment climate that exists in this field?
That I completely agree with you, because at some point there's a lot of clarity. As far as an investor is concerned, yes, are you abiding by the rules and regulations? Now, whether they're good rules and regulations which actually help patients and doctors, or whether they're bad rules and regulations, really, as an investor, what difference does it make to me? As long as it's there and I'm filling the check boxes, I'm protected. So I completely agree with that. That a lot more money is going to be able to come in as a result of this. My hope also is that when this money starts coming in, we'll be able to invest in better technology, we'll be able to do better things. Patients will become smarter and more sophisticated and will be proactive and will start demanding information rather than waiting passively for a doctor to choose to give the information or to choose to hide the information. That's the only point which I have.
Absolutely. So, as you rightly pointed out, there can be two sides. I mean, there can be good regulations and bad regulations. Now, it's only time which will really decide on the efficacy of the legislation which has come. Going beyond that, Kiran, bringing you into the discussions, you have seen a lot of both sides of the debate. What is your perspective on it, particularly coming from Oasis, which has seen rounds of investments?
Yeah, thank you for the opportunity. It was an interesting discussion so far. All I can do right now is probably talk about the last 13 years journey that we had. We went through a 0 to 1 journey for the organization, then the 1 to 10, and then the 10 to 100 journey. All three of them in different stages. One was a fully owned clinic where we ran it ourselves. very efficiently. Then it was more the demand from the market rather than the supply that made us think that, we can do a larger impact. And for us, purely governance was one of the aspects, but if I have to say, both the times that we raise money, so I'll just set the context. First, our deep purpose is to help couples have children. I'm one of the co-founders. The other co-founder is Dr. Durga. Her thinking, her time that she spends is all about the patient and what we can do in terms of service. I take care of the business side. So we have our roles very clearly defined. For me, how I can help her get a larger impact out was where we went for the first round of investment. At that point in time, and even at the second round, we never needed money for growth. So this was all about for us to move from one stage of the company to the next stage and getting those sort of people on board. And bringing in an investor sort of gives us that credibility, and we can move from hiring to recruiting people. And at the end of the day, it's a people-driven business, while we actually keep on improving processes. For us to attract that sort of a talent and for us to actually understand the best practices, it has been a very, very helpful thing with the investors coming in. I could say right now that our teams have moved now from responsibility to accountability on this. And with the way the industry is moving, I think platforms where people can actually come and thrive and do exactly what is needed for the patient is necessary. And that will happen more with some sort of an investor coming in and then having a bit of a checks and balances, so to say, rather than doctors and, the people out there taking their calls and running the practices. It's again, it's not a broad brush statement. I'm just saying if we are scaling, as a single center, great, one can run very well. 2 centers, 2. But beyond that, I think there needs to be some sort of checks and balances that should come with either, the right advisors or the right investors on board. So on that, we have actually given an exit to a current investor. So we have one of the few centers in India or the chains where an investor has come in. They've done very well. They've exited. The new set of investors comes with a lot of operational expertise, Gadela Capital, who would actually now work closely with us for our next stage of growth.
Right. Sticking on to you, Kiran, so how would you, what would you like to say if we were to ask you what has worked well for you, in terms of attracting this investment and also the challenges that probably you faced while scaling up as you have done?
So, like I said, in India, I think right now still the demand for the treatments is more than the supply. That's where we are fundamentally. And whatever we can do to augment it sort of helps get to the treatment. So if I say we now have 30 centers, I think within our geography, even if we get to about 60 centers, it still would be less, just from what we can serve. So coming back to the question, when the investor actually comes in, you understand the best practices from different other single specialties. What have been the models that have worked. We would give our inputs on what actually have worked, and it's a partnership. It's a mindset that probably a founder should have. If the founder doesn't have the mindset that they're willing to actually take those inputs and work that out, it's very difficult to move forward. We have learned it over the period of time. Investors do have their expectations. They're very, very clinical about it, but that's the head which will help us actually move forward. But the heart of the organization and the guardrails remain with the doctors and the people who have actually built it from scratch. So it's a jugalbandi of sorts to actually make it work. And with an investor coming on board, my experience has been clearly that we've been able to attract far better talent. We have a group of people who are discussing. There are no unilateral decisions. We actually go together. So it's a very more professional setup where people, process, technology, all three of them sort of improve as we go along.
Right. Bringing Vishwanath into the discussion. So Vishwanath, 2 things. Your perspective on the ongoing discussion and how do you make a sector more promising, say, to a potential investor? And what is the role of the ecosystem that plays in the larger scheme of things?
Sure. So quite entertaining, as you had said, and we'll be friends before and after the panel discussion.
He was the one who set the ball rolling.
Absolutely, absolutely. Let me, so a couple of comments, right, without getting into specifics. I think, this panel was supposed to be about capital, right?
Yeah.
But you've seen, I think I was just watching, 10 minutes of the 30 minutes that we spent, we've talked about the law, which means how important and how much it is changing. The parallel that comes to my mind is if you go back in late 90s and early 2000s, when, all of a sudden Infosys has started doing well, TCS has started doing well, and the government woke up and saying, hey, this is a sector. And they formed an IT ministry, right? And everybody said, oh, this will be the end of this industry, right? Software will die. Did it happen? No, right? We are one of the leaders in the world now. So, yeah, is there initial pain? Are we feeling it? Absolutely. We are feeling it too. And I think, you have to see demographics very well established. There is a need, agreed. As a country, we need it. And the numbers range from anywhere between 26 million to 50 million. Is the government supporting this from funding? Is it part of Ayushman Bharat? Is it on their priority list? The answer is no. Now, how do you get private investment in there? And I do firmly believe profit is not a bad word. I'm sorry. Profit is not a bad word. Profiteering is. So how do you differentiate between these two? Saying profit is fine, sustainable profit is fine, profiteering is bad. So in the absence of, lack of government funding support, you have to get private capital coming in, servicing this. And yes, they would look for an ROI, etc. But yeah, profiteering is, I still agree, not putting patients first is just not right. If you have either of these partners, either the practitioner or the private equity company as we are taking it, to be with the bad motive, not keeping patient first, it is a competitive market. They will fail. And either one, the onus lies on both. You need the right practitioner. You also need the right investor. And once you have that, you have a success story which serves more patients. So I firmly believe, that, and I'm sorry, I'm saying, insurance, I worked in insurance very clearly. If we say, insurance should cover this, well, I feel like passing the buck, honestly. Now, that's insurance problem. Do we realize 1 in 3 claims in India is a fraud? And what will happen if you start covering, and I've been in insurance, if you start covering a sector with no guidelines, no SOP in place, that 1:3 will move even higher, right? So I think just we have to be very, very clear that yes, there is initial pain. We do need capital, and the future is always bright. I think India is the bright spot in the world right now, and I think the next decade is India's. Any sector you pick, and I think this is no exception over here. We as participants, what we have done, of course, cost is going up, we realize that. So we've put a microfinancing program in place in an ethical way that, aspiring couple can come in. And I think the latest numbers we saw, we've dispersed over about 5 to 6 crores of loans to couples who are aspiring to have a child. So we will continue to innovate for India, in India, and for the world. We export to about 40 countries. We are one of the lowest cost producers over here, higher quality products. But we are also thinking, saying, hey, if I just supply products, that's not good enough. As a responsible industry participant, we have to make sure that our patients are being served. And by dispersing these loans, by setting up the helpline for the centers to enable themselves to this act, I think we are trying to do our little bit to make this transition smoother for everyone. So that's what I feel.
Right.
I just like to add one point.
Kiran.
Is in the ecosystem, the practitioner, I personally believe, with the experience, that shouldn't be burdened with the other activities that are out there. So in the ecosystem, while we have the practitioner, we have the investors, the management and the operating team out there should be now strong and robust enough to support them to actually deliver that service. Otherwise, if practitioners sort of gets to about 60 or 70% of the time handling this, it becomes and investor would not play a role there because they won't understand it. For them, it's about the right MIS and getting things done. So.
Right. Aniruddha, going back to Aniruddha, you said that, you have been wearing...
Everyone's picking on me. Come on, guys.
No, because you said that you have worn...
I'm perfectly okay with that. Not a problem. Go ahead, sorry.
Yeah, something that, Kiran also alluded to earlier. And you also said that you have worn many hats. So how would you distinguish between, say an entrepreneur or an investor and the kind of approaches that they should take in order to really ensure that the investment is there?
I think that's a great question. And I'll tell you what I believe. I believe a physician in private practice, in one sense, is a bootstrapped entrepreneur. He is funded, but he's funded by his patients. And consumer funding is the best kind of funding available because interests are completely aligned. You know that if you do not provide a good service to your patient's not going to come back. You have to depend purely on word of mouth. I think when you take in capital, and the trouble is capital comes in all shapes, all sizes, lots of baggage, there's always a honeymoon phase for the first 3 or 4 years when the investor is the nicest guy in the room, the entrepreneur is the best person, or 5 saal ke baad, you find out what people's true colors are. And I've seen some of that stuff. And it's not like I have a very high opinion of private practitioners either. Please let me understand. I'm an equal opportunity critic. I'm happy to call a spade, irrespective of who's doing it. Are there great IVF chains? Of course there are. And the trouble is, let's also be honest. You know why this IVF law came about? Because we asked for it. Because we knew that other IVF clinics were cutting corners, were cheating patients, were exploiting surrogates, were exploiting donors. And we as doctors who are supposed to be leaders of our medical profession chose to turn a blind eye. Because, hey, these are doctors, I don't have to care. And because we took that approach, this is why the government has come down. And I'm sure if I was in the government, I'd most likely end up doing the same thing. The trouble is that you've ended up throwing out the baby, literally, with the bath water. You're preventing infertile couples from having babies which they could have. And that's the tragedy. But like someone correctly said, a lot of this is going to evolve. Hopefully some things will get better. Some things will get better because we have conversations. Some things will get better because the Supreme Court hopefully will step in and say, this is ridiculous. This is not patient-friendly. Very early days, very hard to say. But you know what? I'm the eternal optimist. So I don't think that's going to change.
Well, with that note, yes, Kshitiz, you want to add something?
I'll just add a small thing. I think we always keep differentiating between individual clinics run by doctors versus chains being run by private equity. Please remember that in a chain also, all the clinics are run independently by doctors who are heading the center, right? So it's not about, private equity always talking about profit, profit, profit. And I agree with Kiran, and I'll just give some data about ourselves from Indira IVF. I think whatever investments we've taken in the past, nothing has gone to the clinic. It has always been given to some existing shareholders to exit the company. So I think we don't need so much of capital to infuse in the company for expansion that we will press the pedal after you have those investments in that go and expand, go and make profits, place everything before profits, and then just go out and just do everything or anything that you want. So I think that we should remember. And secondly, we were talking about extra forms Dr. Malpani mentioned. I think, has anybody gone outside India and seen how much of documentation is there? We are not even 30% or 20% of that, right? If we have to reach that standard, that quality, that recognition in the global fertility world, we will have to improve our documentation, all said and done. Every one of us, including the chains, including individual clinics, and if somebody has gone through NABH or QAI process, they would understand that what many documents are required. And it's not just a clerical or a babu work, I would say. It eventually, down the line, helps you improve your quality because it is that culture that you want to imbibe into every single person in your clinic, that if you have to do this work, this is a checklist. You must have seen pilots flying a plane, they always have a checklist. Senior pilots, 20 years, 10 years, flying plane every day, 2 flights, still they have a checklist because everybody wants to ensure that everything is done every day in the right manner.
Well, you have advocated for the checklist approach. Any other panelist who wants to very briefly, is there any question that we can briefly attend to? Otherwise, we'll call it a wrap. So thanks a lot for joining us today. It has been a wonderfully insightful discussion. I personally learned a lot about this field, this sector, and the dynamics that there are, and we touched upon various aspects of the investment angle, how it comes, where it comes, what are the various modalities that it entails that we often miss out on when we see a picture, not in a very wholesome fashion. So I think we have been able to bring out all those things. Time is up. I wouldn't want to prevent or keep people away from their lunches. So it's been great talking to you. It's a wrap. And thank you all, gentlemen, for joining us today. And a round of applause for our very entertaining and lively participants.